When you hear whooping cough, you probably picture something from, I don't know, a black and white movie, right? A disease from a long gone era. But what if I told you it's making a serious comeback? And this isn't some dusty history lesson, folks. This is a public health story that is unfolding right now, and it affects every single one of us. So that's the million-dollar question, isn't it? In this age of, incredible medical breakthroughs, why on earth is a preventable disease like this one suddenly on the rise again? We're going to dig into that. Okay, so first things first, what exactly is pertussis? Well, it's this really nasty bacterial infection, and it goes straight for the respiratory system. It's super contagious, and it's infamous for one terrifying thing: these violent, just uncontrollable coughing fits that end with this desperate, high-pitched whoop sound when the person is just struggling to get a breath of air. All right, here's how we're going to break this down. First, we'll look at why this cough is making a comeback. Then we'll get into the 3 stages of the illness, figure out who's most vulnerable, talk about how doctors fight it, and then, the most important part, how we can prevent it in the first place. Okay, let's jump right in. Section 1, the comeback cough. And seriously, that name's no exaggeration at all. This isn't some far-off threat we're talking about. This is happening right here, right now in our own communities. So to put a number on it, just look at 2022. There were almost 2,400 reported cases right here in the US. Now, I know what you're thinking, that doesn't sound like a pandemic. And you're right, it's not. But it's a massive red flag. It tells us the bacteria is still out there, circulating, and causing these little local epidemics that flare up every few years. So why? Why is this happening? Well, the research really points to 2 main culprits. First, the immunity we get from the vaccine, it's not a lifelong thing. It actually fades over time. And second, and this is a really tough one, is the issue of some parents choosing not to vaccinate their kids. And that creates these vulnerable pockets in our communities where the disease can just take hold and spread. Okay, so we know why it's spreading, but what does this illness actually do to the body? Understanding its progression is so important because it shows you just how dangerous this really is. Trust me, this is way more than just a bad cough. It's a full-on, multi-stage assault. The whole thing usually unfolds over about 6 to 10 weeks, and it happens in 3 really distinct phases. It's sneaky at first. It just looks like a common cold. But then, after a week or 2, it morphs into that second, really dangerous stage with those horrible, relentless coughing fits. The final stage is recovery, but man, it is a long, slow grind that can take months. And this quote, wow, it really captures what that second stage is like. We're not talking about a single cough here. Try to imagine a rapid-fire burst of 5 or more really forceful coughs that leave you totally out of breath. And then that awful whoop sound. And this can happen over and over again, all day, all night. This brings us to a really, really crucial point. Who is actually in the most danger here? Because while, yeah, anyone can get pertussis, the consequences are definitely not the same for everyone. So this might surprise you, but today over half of the cases are actually in adults over 20. And for an adult, it might just feel like a really bad cough. Maybe walking pneumonia. But here's the problem. They become carriers, and they can unknowingly spread this dangerous bacteria to the most vulnerable people around them. And this is the most heartbreaking statistic of all. While adults get sick, it's babies, infants under 1 year old who are at the highest risk. Almost all the deaths from whooping cough happen in this incredibly fragile little age group. For a tiny baby, this disease can be absolutely catastrophic. We're talking about really severe complications, things like pneumonia, terrifying pauses in breathing called apnea, choking spells, seizures, even permanent brain damage. This is exactly why it's treated as a pediatric emergency. So, when you're faced with a threat this serious, how do doctors and nurses fight back? Let's take a look at the diagnosis and the critical treatment options. With a disease that moves this fast, getting a quick diagnosis is everything. Doctors can take a mucus sample and try to grow the bacteria in a lab, but that can take up to a week, and that's a week you just don't have. The much better, faster, more modern way is a PCR test. It can spot the bacteria's DNA, and you can get results in just a matter of hours. For the most severe cases, especially in these tiny infants, the treatment is really intensive. We're talking about hospitalization, being kept in isolation to stop the spread, and sometimes they even need a ventilator, a machine to literally breathe for them. Okay, after all that heavy, serious news, let's pivot to the most empowering part of this whole story. Because as dangerous as pertussis is, and it is, it's also a preventable disease. And this, right here, is our #1 line of defense, the vaccination shield. It's a strategy designed to protect us our entire lives. It kicks off in infancy with a series of shots, gets a really important booster around age 11 or 12, and then we need more boosters as adults because remember, that immunity fades. And what is absolutely critical is vaccination during pregnancy. That passes life-saving protection directly to the newborn before they're even old enough to get their own shots. This slide just lays it all out so clearly. Look at the difference. On one side, you have the reaction to an infection, hospitalization, isolation, a huge risk of severe complications. And on the other side, proactive prevention, a simple vaccination schedule and booster shots that protect not just you, but everyone in your community. And prevention doesn't even stop there. If someone does get diagnosed, doctors often give antibiotics to their family members and other high-risk people they've been in contact with. This is something called post-exposure prophylaxis, and it's a super important tool for shutting down an outbreak before it can even get started. Now, this is a really common myth we have to bust. You might think that if you get whooping cough once, you're immune for life, but that's just not true. The natural immunity you get can fade over time, just like the vaccine immunity does. And that's exactly why boosters are so important, even for people who've already had the disease. So we're going to end with a question that really brings this all home. This isn't just some abstract topic for a medical textbook. It is a real present-day issue. The comeback of the 100-day cough is a powerful reminder that our collective health, it depends on a shield that we all have to help maintain. So the question is yours up to date?